Hi, I'm Dominic Perry. I'm a student pursuing Master of Public Health at the Copperbelt University in Zambia. I'm going to present to you an ePoster whose title is Barriers and Facilitators to Tuberculosis Services Uptake Among Men and Women of Childbearing Age in Mumbwa District of Zambia. The background is that TB still remains a significant public health challenge in Zambia, particularly among vulnerable populations such as men and women of childbearing age, that's 15 to 49 years of age. We see that despite the availability of effective diagnosis and treatment, TB services uptake remains still very low in many parts of the country. Hence this study. The method. This study employed a mixed methods approach combining both qualitative and quantitative data collection and analysis. The study population consisted of men and women of childbearing age, as already mentioned. Data were collected through surveys, focus group discussions, and key informant interviews. The study used a combination of purposive and random sampling techniques to select study participants. Were there any challenges? Yes, there were. These included inadequate funding and staffing gaps in TB programs, poverty and food insecurity, then stigma and lack of awareness about TB. Key findings. The key findings included inadequate funding and staffing gaps in TB programs, which limited the frequency and the quality of supervision visits, affecting healthcare worker performance. Poverty and food insecurity were major socioeconomic barriers to accessing TB services. Additionally, transportation costs and lost income due to TB diagnosis and treatment were significant concerns for the patient. Stigma and lack of awareness about TB were significant cultural barriers to accessing TB services. Were there any facilitators to TB services uptake? Yes, they were there. And these included increased awareness. By educating communities about TB, improved services uptake, community-based interventions and health education programs increased awareness about TB symptoms, diagnosis, and treatment. While under community support, we see that community-based interventions and support groups enhance TB services delivery. Improved healthcare infrastructure. By strengthening healthcare infrastructure and increasing access to TB services, improved services uptake as well. We see that in figure 1, where this is about knowledge of symptoms, 30% of the participants had low knowledge on TB and 70% had good knowledge about TB. Figure 2 is about distance to healthcare facilities, where 40% had difficult accessing healthcare services due to distance, and 60% had easy access to healthcare services. And figure 3, which is TB services uptake, we see that about 60% were able to utilize TB services, while 40% were not able to utilize TB services due to lack of awareness. Recommendations. Important to increase funding for TB programs in order to improve healthcare infrastructure and staffing, and it's good to implement community-based interventions and support groups to enhance TB services delivery. Then provide health education programs to increase awareness about TB symptoms, diagnosis, and treatment. In conclusion, we see that funding is a critical component in order to improve healthcare infrastructure and staffing, and implementing community-based interventions and support groups to enhance TB services delivery is very critical, and continuously providing health education programs to increase awareness about TB symptoms, diagnosis, and treatment is very critical as well. I thank you for listening.